Good morning, class. Today we're going to be talking about a rarely used ventilator mode called PAV, Proportional Assist Ventilation. And it was invented by this handsome guy right here, the famous Dr. Magni Unions. So, what is PAV? Well, it's a spontaneous breathing mode that offers assistance to the patient in proportion to how much the patient can inspire. It measures and adjusts to changes in the respiratory mechanics, or the compliance and the resistance. So it adapts to what the patient needs. So the less the patient works, the more assistance is provided by the machine.
How does it work?
How does it work? Excellent question. Well, it instantaneously measures the flow and volume being inspired by the patient. It does this by calculating the compliance and the resistance of the respiratory system. So you can set the ventilator proportion up to about 80% of the patient's elastance and resistance, meaning the machine will do 80% of the work while the patient only does 20%. And this ventilator mode is patient triggered, pressure limited, and proportionally targeted, hence the percentage we set. And it is flow cycle. Another question?
I don't understand something here. Could you maybe explain it to me? How are the patient's efforts calculated?
Well, it's based on the equation of motion. It calculates the respiratory muscles and the mean area pressure using this calculation. And well, I have worksheets for all you guys, so we can do all these calculations. Well, you guys can do these calculations for homework, so we can have a better understanding. Yes, another question?
Why would you use it?
Why would you use this mode? Well, it's for patients who have increased work or breathing problems with worsening lung characteristics. It's also for asynchronous patients who still have a stable inspiratory effort, since it is indeed a spontaneous mode. And for COPD patients who are very vent dependent. All right, class, I have invited one of my very distinguished colleagues who graduated from Georgetown University, and he's going to discuss with you guys the advantages and disadvantages of PAV, and then we're going to explain how to set it up. Dr. Provence.
Thank you, Professor. Thanks for having me. Good afternoon, good morning, class. I guess it's still morning out there. Well, what are the advantages to PAV? Well, the patient controls the vent variables, the tidal volume, the peak inspiratory pressure, and both the I time, inspiratory, and expiratory time. It also allows us to turn changes in the amount of ventilator assist over time. Now, when this mode, PAV, is used with CPAP, the inspiratory muscles, they tend to work near normal, and it also decreases muscle atrophy. How do you use this? Now, there are some disadvantages and risks to this particular mode. Patients must have adequate spontaneous drive, and I also remember when doing my clinical rounds, my instructor always stressed to me the importance of setting the alarms appropriately. And this is appropriate for this as well, because this mode, PAV, if you don't set the pressure and the tidal volume alarms correctly, then the ventilator will assist too much. Also, you must check those connections. Make sure they're good and tight, because if they're not, you'll have auto cycle. The trigger effort can be increased, so you must keep an eye on auto peak so that doesn't increase. And also, you must set your backup apnea alarm. It's funny that you mentioned Dr. Eunice, because I had a chance to meet him one time when I was in Canada, and he took me to this place, a wonderful, wonderful place. I think Amy Thomas, your instructor here, maybe she can get the group together, get on the bus, and go on a field trip to this wonderful place. It's Jay's Museum of Respiratory Care. And when I was there at that place, he showed me, the curator showed me this old Winnipeg from 1986. And this is the machine that Dr. Eunice developed that algorithm on, that your teacher passed out to you. He used that and developed it on this machine. But you guys don't have to worry whenever you get to your clinical sites or get jobs, actually. You'll be able to use a much newer and much easier machine, the Puritan Bennett 840. And I'm going to show you how to set that up for proportional assist ventilation.
All right, class, gather your things. We're heading to the lab.
Okay, class. We're going to show you how to set up the Puritan Bennett 840 for proportional assist ventilation. Now, you want to make sure that you have an adult size circuit. It only works with that. And typically, whenever you turn on your machine, you're going to run the SST, the short self-test. But for demonstration purposes, we're going to forgo that. You're going to hit your new patient, and first you're going to set up that new patient with the ideal body weight. We'll adjust that accordingly, and then you're going to hit your mode button and pick spontaneous. And then you're going to go to your spontaneous type. Now this is a proportional assist, so you pick PA. Now your patient's ideal body weight has to be over 25 kilograms, and your tube size has to be at least 6 millimeters. Now next you're going to pick your tube size and the type of tube that you have, be it an ET tube or a tracheostomy tube. Now we're going to set up some of the alarms. Your first one is your spontaneous tidal volume. I'm going to set that appropriately, and also your peak pressure, set that as well. And you're going to hit accept. You're going to accept all those connections, and we can hook them up to the circuit. We have a test lung here for some demonstration purposes. Now when selecting the appropriate percentage level of support, you want to consider the following things. You want to wait 10 to 15 breaths for the algorithm to stabilize and the patient's response to the new percentage of support before we change any other settings. Now we want to use the work of breathing bar as a guide. Now we want to adjust the percentage of support setting to maintain the patient's work of breathing within the green region. Now if the work of breathing point, the indicator there, is to the left or to the right of the green region, the patient is being respectively over-supported or under-supported by the ventilator. And of course, you're going to adjust all of these things in your particular clinical situation. These are just some guidelines. Thank you.
Wait a minute. There's still something I don't understand. Compared to conventional ventilation, like regular pressure support, what makes this better? Well, that's a good question. Well, pressure support, you have a constant level of pressure, which is set by the clinician, whereas with PAV, support varies with the patient, depending on their inspiratory effort. And with pressure support, you have a minimum support as long as the patient triggers the ventilator. Whereas with PAV, there's no minimal support and optimal synchrony with the patient's spontaneous breathing.